Hi, I'm Dave Fornell, the editor of Diagnostic and Interventional Cardiology magazine, and I'm here at the Society of Cardiovascular Computed Tomography in Las Vegas 2015, and I wanted to take you on a tour of some of the new technologies and trends that I'm seeing at this year's show. We're in the Philips booth at SCCT 2015, and one of the highlights that they have at this year's show is their Icon Spectral CT. This technology enables spectral imaging to be on all standard CT imaging. The technology allows spectral imaging to be turned on all the time on standard CT scans. So during post-processing, you could pull up the spectral images and look at the data sets at any energy level. This is an example of a pulmonary embolism with the multiplanar view on the top, with a density map on the bottom showing densities based on atomic numbers. The blue areas that are showing up on the bottom of the lung is part of a pulmonary embolism. This sort of technology can help enhance imaging that is sometimes difficult to do, or be able to reduce the number of scans you have to do with repeat protocols. This is another example of how spectral CT might be applied in everyday imaging. The image on the left is the standard multiplanar view with metal artifact. On the image on the right, it's showing how spectral imaging could help reconstruct the image and show you areas that otherwise would be obliterated by the artifact. This is another example of how spectral CT may be applied in everyday radiology in the future. This is showing a kidney stone in a patient's left kidney. Using the spectral CT, you can start to image using different filters and show that the stone is not completely made of calcium and that it's more than 50% uric acid. This may change the course of treatment for this patient. Another advantage of spectral imaging is the ability to view the same image at different energy levels instead of having to shoot separate exams and use different protocols. This is an example of an image that was shot at 120 keV, and in the mono E view at 50 keV shown here, you can get better separation between densities such as iodine, contrast, and calcium, so the image could remain at diagnostic quality where otherwise it might not be diagnostic quality. One of the hottest topics of discussion at SCCT 2015 was the use of HeartFlow's FFR CT system. This software allows you to take a CT scan and use the data set put through a supercomputing algorithm to derive virtual FFR readings for the entire coronary tree instead of having to use invasive cath lab FFR. This technology is expected to be the new gatekeeper for the cath lab in the coming years, and also a way to non-invasively evaluate a patient with chest pain. CT perfusion imaging was another hot topic at SCCT 2015. Perfusion imaging has been around for several years for neuro, and recently in the last 5 years it's been coming of age for CT. The myocardial perfusion exams are performed with a slightly different protocol from the standard CT angiography. The software analyzes the blood flow based on iodine contrast flow through the myocardium. Contrast maps can be created either on a bullseye plot or showing a 3D image of the myocardium with a color code system on it showing concentrations of contrast at various phases of systole and diastole. It's expected that perfusion imaging will be a standard of care within the coming years. This is an example of Vital Images perfusion software which recently gained FDA clearance. This is another example of a perfusion software offered by Terra Recon. One of the trends I've seen at several shows over the last year is the interest of device companies in the imaging modalities used to image them. At ASE earlier this year, Abbott was demonstrating its miter clip device, which is used and imaged exclusively in the interventional lab under TEE. At SCCT 2015, Edwards is displaying for the first time, highlighting its transcatheter valve technology. CT is the imaging modality of choice for both paraprocedural planning and also for developing 3D images used for guidance during the procedure. This is the Sapien 3 valve, which has a new fabric skirt on it, which is helping seal the aortic annulus for better prevention of paravalvular leaks. We're in the Ziosoft booth at SCCT 2015, and one of the trends that we're seeing in cardiovascular CT is the use of 3D printing. This is an example of a 3D data set that has been changed and printed out into a 3D acrylic model. These models can be used for patients with congenital heart issues or with anomalies that either a cardiac surgeon or an interventionalist installing a TAVR valve or a miter clip may need to be aware of. And these models can help personalize medicine by having an exact anatomical model of the anomalous anatomy directly in the hands of the surgeon or the interventionalist. software vendors that are developing advanced visualization applications for CT are coming up with new ways to process that data to pull new information out. This is an example from Ziosoft showing a newly launched product for strain. This is showing a strain on a dynamic CT image, which may be used for either diagnosis of disease states in the future, or it could be used for analytics of the left ventricle for any defects.